Hello, my name is Charlotte Marr, and I'd love to talk to you about a study I did with the team at City of Hope looking at where metastatic bladder cancer trials are located across the United States. So for a little bit of background, clinical trials are often how patients get access to these novel therapies, yet they're not evenly distributed across the country. Historically, socioeconomically vulnerable counties tend to get left out, but that has never been characterized for metastatic bladder cancer specifically, so that's what we aim to do. For our methods, we looked at 211 clinical trials and mapped every U.S. county that had an active site for each trial. Now, I'd like to direct your attention to Figure 1, which shows the county-level distribution of these metastatic bladder cancer clinical trials. As you can see here, it is more concentrated in areas like Los Angeles or New York that are more urban, while it is more sparse in areas such as the Great Plains and much of the South. The number I'd like to point out here is that out of 3,145 U.S. counties, only 646 have a single MBC trial site, meaning that roughly 80% of the country has no local access at all. Now, I've been talking a lot about social vulnerability, and Figure 2 breaks down what that actually measures. So for the Social Vulnerability Index, the CDC takes into account 16 census variables and combines them into a single count that measures every county from low to high vulnerability. They take things into account such as poverty, homelessness, unemployment, or not having a vehicle. So when I say that a county is highly vulnerable, that's what it means. Now, if there's one thing that I want you to take away from this poster, it's that the counties being left out aren't random. They're disproportionately the same counties that are already carrying the greatest social, economic, and disease burden, meaning that patients who might benefit the most from these trials are unable to have local access. Going forward, trial sponsors should factor in county-level vulnerability into where they choose to place these trial sites. Thank you so much for listening.